Welcome to Staying Connected, a podcast where I talk to people about their stories with VEDS, Marfan, Loeys-Dietz, and related vascular and aortic connective tissue conditions. The views, information, and opinions in this podcast are those of the individuals involved, and the information presented does not constitute medical or other professional advice or services. Welcome back. Today, we're going to hear from Deb Kruk, who is joining us to share her experience with vascular Ehlers-Danlos syndrome, or VEDS, including her own diagnosis in her 60s after losing her son Brian to an aortic dissection at 40 years old. She'll share her and Brian's story in this episode. If you like this show and you want to help our communities raise awareness of VEDS, Marfan, and Loeys-Dietz, consider joining my Patreon. This show wouldn't be possible without the support of my subscribers there, so if you're already supporting the show, thank you. Let's get into the show. Hey, Deb, thank you so much for joining me on the podcast to share your story with vascular ADS. Do you want to introduce yourself to people who don't know you, like your name, how old are you, where you are?
Thanks for having me. My name is Deb Kruk. I live in Illinois. I'm 66 years old. I have been diagnosed with VEDS. It'll be 2 years in August, along with several of my family members.
How were you diagnosed with VEDS? Like, how did that come up? So you were diagnosed when you were 63, 65, 64. 64. I can do math.
63 to be 64-ish, so something like that. Yeah, 63. Well, our VEDS nightmare started on April 28th of 2022. My 40-and-a-half-year-old son went to the hospital. My daughter-in-law called us around 9 o'clock and said that Brian had abdominal pain, and they were in the hospital. And at first I thought he had a gallbladder attack because he was on a keto diet. So I didn't really panic, but I thought, you know what, I wasn't going to go to the hospital. She was calm. She said, we'll keep you posted. But I thought, oh, you know what, I'll go sit with her. So I got dressed, got in the car, started to this. They live in the city. We're in the northwest suburbs of Chicago. And along the way, my husband called to say that my daughter-in-law, Sarah, had called the house phone 3 times, and he said she sounded frantic. And I couldn't figure out why she called the house phone, so I called her, and she was indeed frantic. She said that Brian couldn't feel his legs, and he collapsed. And I think they had done an EKG and sent him to the waiting room. And I said, you need to tell somebody. Go tell somebody. And she did, and in that confusion, I took a wrong turn on the expressway, so that delayed my getting there. But I did finally get to the city, got to the hospital, and it was probably 10:30 at night. So I got to the ER, and the chaplain came to greet me. And of course, I thought the worst there. But he told me no, Brian was alive, that, he was sent to take me to the room. And he took me to a room where my daughter-in-law was. It wasn't Brian's room. Oh, on the way, though, I had said, does he have an aneurysm? And she said they don't know. They can't get his blood pressure up. They're giving him blood. They couldn't get him to CAT scan yet. But when I got there, they were at CAT scan. And one of the residents came in and told us that he had a dissection. And it was really impossible to comprehend. He was a perfectly healthy guy. He was a 4-sport athlete in high school. He always took care of himself, ate well, exercised, and like I said, he did this keto diet to lose some weight. So with that, I'm a nurse, so I kind of get how things go. I heard the commotion coming down the hall from CAT scan because it took a team to get him there. And he went by, and I went to the door, and I called his name, and he turned around, he sat up as much as he could, and, Mom, thanks for coming, is what he said. So then we went back in the room. A vascular surgeon came in, a thoracic surgeon came in. Where his dissection was, They weren't quite sure if it was a type A or type B. Ended up being a non-A, non-B. And they weren't sure who was going to need to do what. So,
yeah, and that's like type A or type B aortic dissection.
Correct, yes.
So it wasn't either of those.
It was not, right.
Yeah. What made you think of an aneurysm to begin with?
I was an ER nurse, and the fact that he couldn't feel his legs, that just hit me, and that just struck me,
Yeah. So what happened? What happened next?
So then and I know it seemed like forever, but I know that they were assembling the team. I know, it was 10:30 at night. It's a level 1 trauma center, but I know they needed to get the team. I just really just wanted them to get him to surgery. I asked if we could see him before he went. They were about to intubate him because he was bleeding into his chest. And to protect his airway, they were about to intubate him. So we went to say goodbye, and then we waited. And about every hour, a nurse would call and say, he's stable. And that's pretty much all she would say. He's stable. So my daughter-in-law was thrilled to hear that, but I'm like, this is not good. This is not good. And then about 5 a.m, the vascular surgeon came out to say that he had arrested and they were trying to get him back, and they couldn't.
I'm so sorry that you lost your son.
Thank you.
Yeah, take whatever time you need.
Yeah. So that was, of course, a nightmare. But a couple days later, this vascular surgeon called my daughter-in-law, and she was not emotionally able to take the call, so she called me and gave me his number, and I called him. And I think it was Brian died on a Friday, and I think it was Sunday. And he said that he had talked to several vascular surgeons in the area, and he said, I think your son had vascular Ehlers-Danlos. And I'd never heard of it, and I was just blown away. And he said he's a typical presentation. He's 40 years old, sudden aortic dissection. He's typical. And I just thought that was just so kind of him that he did that he reached out to several surgeons, and that's what they came up. He goes, I'm 95% sure that's what it is. And you need to get your other children tested.
So did they test Brian in autopsy then?
They didn't do an autopsy, but yes, he sent out the blood for the genetic testing. And I thought that was very kind too. It was kind of out of his lane,
Yeah. Very nice.
Very nice. Yeah. And he was amazing. He really was amazing. So yeah, he sent that out. And then in the meantime, my younger son got tested at an outside lab. I think it was GeneDx. And we were told to see a geneticist. Me, my husband, myself, and my daughter. My daughter and my other son are twins. So in the meantime, reading up on this, I'm like, Brian didn't have any symptoms. I don't have any symptoms except easy bruising. I've always bruised very easily. So we went to see the geneticist, and he examined us, he took our history, and he said to us, I don't think you have it. But because my younger son had gone to the independent lab, and they said, have your parents get tested. So I said, well, I think we should test them. The geneticist again said, I don't think you have it. I said, well, can we still get tested? And he goes, sure. It was like we had to push to get tested.
Yeah.
Yeah. And then I ended up being positive. My husband was not, my daughter was not, thankfully.
So it's you and your son that passed away, Brian.
Right.
Yeah. One of the things that you mentioned in the pre-interview, and I just want to make sure that it gets in here, the vascular surgeon had mentioned that he was a typical presentation, like the sudden aortic dissection. And was there anything else that he noticed that made him think about vascular EDS? When he put the art line in, he said that the resident had to put pressure on the artery for the entire procedure because it just crumbled.
And he said that about his vessels, that they were like tissue paper and they just crumbled. They tried to bypass the vessels, and they said he said things that should take me 15 minutes to sew took forever. He said forever. So, yeah.
That was so nice of him to follow through and figure out
Oh my gosh.
why that was.
Right? I mean, just amazing. Amazing.
Yeah. So now you've got a diagnosis of vascular EDS from your genetic test.
Correct.
What did that feel like?
I felt like before all of this, I considered myself a healthy, vital, active woman. I have longevity on both sides of my family. I have aunts and uncles that lived to be there into their 90s. My dad lived to be 84. His parents lived to be 90 and 86. And all of a sudden I felt like I didn't know if I would make it till Christmas. That's how I felt. Just very vulnerable, very fragile. Just, yeah. And then, on top of all this immense grief from losing my son, it was a lot. It was a lot.
Yeah. Did you find somebody where you are to order tests and stuff for you? Like artery scans?
Through the Facebook page, through the VEDS Facebook page, I was connected to a cardiologist out of Northwestern. And she saw me immediately, and she ordered the MRAs immediately. And then I was found to have bilateral cerebral artery dissections remotely, don't know when, and a left vertebral artery dissection at some point in my life. Asymptomatic.
Yeah.
Yeah.
So there's not a moment that you can look back on and be like, maybe that was it.
I had 2 incidents of horrible vertigo, and I said that to the vascular neurologist, and he goes, no, that's not it. I go, well, that's all I got. Unless it was birth trauma, that's all I got.
Yeah.
I have no idea. I have no idea. Thankfully, I have no idea.
Yeah. That's a lot of information to process.
Yeah.
In a short period of time. Like, what is the stretch of this period of time between when Brian had his dissection and when you had your scan? It
was April to November. I didn't get scanned.
Yeah, that's a very short period of time.
Right.
How did you kind of get through that period of time of feeling, you said you felt more vulnerable and that it changed the way that you kind of felt about being a healthy woman. Like, how did you get through that period of time? What kind of changes did you make in your life, and did any of them stick? Or
well, at first I do weights because it's my goal in life not to have diabetes. So I lift weights and I exercise every day religiously. So I kind of took a back seat. I thought, well, they told me don't lift weights, don't put pressure, don't do those things. So I stopped. Didn't feel great about that, but I did stop. I started therapy. That helped a lot. And yeah, I have reverted. I do lift weights. I don't lift as much as I used to. I'm mindful of that. But yeah, I just feel like I need to live my life. I need to be me. That's what I need to do. I need to be me.
Yeah. And did testing, reveal more people in the family? And how did that affect your thoughts on it?
Well, okay, so my siblings tested. I have 2 brothers and a sister. My older brother, my younger sister came up positive. My youngest brother did not. And then my cousin, my older cousin, first cousin, felt like she had symptoms. She goes, I'm getting tested. She goes, I think I have this. And she did, and she does. So then we deduced that her mother, my dad's sister, both had it, and that either their mother or father had it, and we think it was my grandmother, my dad's mom. Just because she had blood clots through her life. She had, basically a healthy woman. She had diabetes that she controlled meticulously. She lived to be 86 years old.
Wow.
And then my sister's son also has it. He's in his 30s. his scans were clear. My sister has some aortic dilation. My cousin does the same. My cousin turned out she had a stroke at some point, they said. She has no clue. She's 67 years old and she's still a nurse in the emergency room. She's like, I don't know when that happened. I have no idea when that happened.
Oh my goodness.
Yeah. So
like big family history that was revealed by this.
My dad had an abdominal aortic aneurysm that was repaired with a stent, and we attributed that to he smoked in his younger years. So that didn't even think about it. And he went through that procedure. They tried to stent him, I take that back, and they couldn't. And then they did an open, and he lived 12 years after that. He had a blood clot, but it was a post-op blood clot too. So otherwise, he was a carpenter. He lifted heavy things. But we have the null variant, which I'm told is the best to have. However, in Brian's case, that wasn't the case. But the cardiologist says he must have had something else. What that is, I don't know. I have no idea. She has no idea.
Yeah.
I would like to find out.
Yeah, for real. And there's, are you part of, this doesn't have to go in the interview, but are you part of the VEDS Collaborative Natural History Study?
Yes.
And did you enroll Brian?
Yes.
Okay.
Yes.
Because that's kind of a goal to answer those kinds of questions with that study.
Yes.
And up to you. If you want to keep this in, we can cut it.
That's fine.
Totally
You can, no, because I'd like to encourage people to be part of these studies. I think it's important. I'm also in the one in Texas, and I can't even think of the name. Oh,
is it the Clarity study?
No, the John Ritter.
The MAX study.
Yeah.
Yeah.
We're in that one too.
John Ritter Foundation.
Yeah.
All the studies.
Yeah. So, I mean, I'm happy to do that. Though I did watch that CRISPR webinar the other night, and there's a pediatric cardiologist out of Massachusetts General who I'm going to write to and just tell my story and see if he has any insight to what that other thing was. Mark Lindsay.
Oh, yeah, Mark Lindsay. That makes sense. Mm-hmm. Yeah. Mark's good people, too. To me, it doesn't, it's just, I've known so many people with null variants who have this, sudden aortic dissection in their 40s or 50s. And so to me, it doesn't seem atypical, but it seems really incredible that, the family overall has had this in the family for a while and not known about it. That it's just something happened, it was resolved with surgery, or didn't even get, prod a question about it, like that stroke. And that as a whole, the family was able to move through it. And it's really, really unfortunate what happened to Brian. Yeah. But to me, it doesn't seem like not the VEDS story,
Right. But hearing the vascular surgeon say, this is typical, and the cardiologist says, no, it's usually the branches that dissect. It's not the aorta. And I'm like...
Yeah, I think research is got to move along in this way. I think that the aortic dissections are more common than we previously thought they were. And I'm glad you're going to reach out to Mark Lindsay too and just kind of answer those unanswered questions of if there was something more.
Looking back, Brian had the pectus excavatum that I told you. He had early gum tissue recession in his teens. He had flat feet, and my daughter-in-law said he had stretch marks, and she couldn't figure out why. I mean, he wasn't grossly overweight. He was a few pounds overweight. Where I carried twins, and I do not have a stretch mark at all. And I carried twins to they were 13 pounds worth of twins. So why? Yeah. I mean, right?
Yeah. So many unanswered questions. And then the other question is, do the other family members have something that he didn't that's protective?
Right.
Because that could go both ways.
Right.
Yeah. So in all of this experience, it's been a couple of years now since your diagnosis and everything that you've been through. what are some things that you really want medical professionals to know about VEDS?
Well, first of all, I'd like them to admit when they don't know. I went to my ophthalmologist just last week, and he asked me about the metoprolol I'm on, and he said, oh, hypertension? I said, no, it's for the VEDS. And he had a medical student with him, and so he starts talking about the hypermobility and blah, 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 and I said, that's not what I have. So then he's kind of pretended that he knew. The thing of it is, when you have something like this, you become an expert. Most people become experts. So admit you don't know and learn from your patient. You know?
Yeah. And then as far as research goes, what do you want in that area?
I think I'd like people to put the puzzle pieces together. I'd like doctors to know about it enough that they could put the puzzle pieces together. Like my nephew who's positive has the facial features. He's the only one that has the facial features. You know, that kind of thing. Or maybe alerted me, and maybe they didn't know enough about it 40 years ago, I don't know, but alert me to maybe that pigeon chest was not benign, that maybe there was something to it, you know, along with the flat feet. And why does a 17-year-old have recession, you know, gum tissue recession? It wasn't for lack of, you know, dental care. I mean, so, yeah. It's like when you fill out those forms at the doctor's office and it says, do you bruise easy? Yep. Nobody's ever addressed it. They just look at it. Yep. Oh, I've put that down for all of my life. I mean, I bruise very easily, and they just gloss over it. I may have a normal platelet count, but what else could it be? You know, that kind of thing.
Yeah, that's really. I'm really glad you brought that up, because that is like a huge area of potential diagnosis or referral to a geneticist or something. And so many of those things just kind of get glossed over, and they paint a picture.
Right.
Of somebody who really does need to look into genetics,
right,
or see a geneticist. Yeah, it's so important. So if you're a medical student or a resident or listening to this, you know, please take that away from this episode. There are opportunities to refer and ask questions and kind of think critically about things that might seem benign on the surface.
Yeah.
Do you have advice for somebody who went through what you did?
I think at first, don't panic, though it's very hard not to. Educate yourself. Get yourself a support group. The Facebook page is amazing. A little bit difficult sometimes. It's a little hard to see other people's the trouble that they're going through, but it's good in a way that you can see that other people are going through the same thing you're going through, and maybe they have advice or paths that you can follow. Do any preventative things that you can, you know, get your screenings. Though those are tough too. Those MRIs, they come up with stuff that, you know, you're being looked at it with a fine-tooth comb, and this is, you know, you've got these thyroid nodules and you've got this, and it's like, holy mac, you know. I have more doctors than I have ever had in my life. I've got more specialists on the payroll than, so far for me, it's been nothing, but you still have to explore it. You know, I had an adrenal nodule, I had thyroid nodules, I had something on the uterus. It was just one thing after the other, and it's overwhelming because you first have this diagnosis of VEDS, and then you've got all these other little things that are showing up and need to be addressed, but it's overwhelming. And I'm a nurse. It's, you know, it's like, it's a lot. It's a lot.
Yeah. Yeah, it is a lot. And that piling of the small things is so, I don't want to say it's funny, but it's very relatable. Yeah. Because a lot of those things, like I've been known to kind of put those off until I have a gap in my events or my other things I've got going on that are like really, really serious. So all this really, really serious stuff. And then I'll have a gap where I'm like, okay, now I'm going to get that pilar cyst removed. on my head. Something so minor. It just gets pushed off.
Yeah, I can't schedule that in. I can't fit that in. And I shouldn't have this many doctors, for Pete's sake. I didn't even take as much as an aspirin before this. And thankfully I only have one medication, but it's a lot. And I feel bad for people who have more, but it's a lot. And I suggest therapy. I do suggest therapy. I think it helps. I never was a therapy person, but I do think it helps to unpack things. And if you had a buddy I met a woman who lives very close to me through the Facebook page, and we're there for each other. It's wonderful. And we're there to talk each other off the ledge. And, it's like, okay, it's not good. Let's take a deep breath. Let's look at this critically, think through it, Yeah.
Yeah. That's so important. Community is so incredible. This community is really helpful and supportive.
Yes, absolutely.
I'm glad that you found somebody that lived close to you. That's awesome.
Yeah, it is good. And my cousin, we're good friends too, and now we're Veds buddies, so, I don't think my siblings take it as seriously. My sister's got the attitude, you know what? Dad lived to be 84. That's kind of her attitude. Well, that is true, but Brian did not, so, yeah.
Yeah. So I really appreciate you coming on and sharing, your story and Brian's story. And I know that Brian's story can be it's very difficult to hear, and probably very difficult for our listeners to hear, and also difficult for you as a parent to live through. So I really appreciate you coming on and sharing that. Would you like to share some of your favorite things about Brian to close this episode?
Sure. Oh my gosh. He was very, very intelligent. He was a lifelong learner. He had a voracious appetite for reading. He always had not one, but several books going. And he could hold a conversation pretty much on any topic with any person. And he did seek that out. He'd talk to that person sitting in the corner. That's just how he was. He engaged people. We were at my sister-in-law's funeral, her dad's funeral. And he was maybe a teenager, maybe early 20s, but he just worked the room and talked to everybody. It was just amazing how he did that. And young or old, it didn't matter, young or old. He loved to cook. He loved to invent sandwiches. And he was on the board of Pilot Light, which is a food education program. And he just loved that. He loved pairing his love of education and his love of food. And it was amazing. They do amazing things. But mostly he was hysterically funny. He was really funny. He was very quick-witted, and he always made us laugh. And we miss him. We miss him very much.
Yeah. Well, thank you so much for sharing that, and for sharing him on the show, and for sharing your story. And I hope it reaches a lot of people and can educate and provide support to somebody else going through what you did too.
Yeah. And basically too, if they say it doesn't look like you have it, get tested anyway. The same thing for my friend who lives close to me that I'm on the Facebook page. Her doctor also said, I don't think you have this, but thankfully tested anyway.
Yeah, that's so good.
Yeah.
That's a great takeaway message. Thank you so much.
Thank you very much for doing this.
Thanks for listening to this episode featuring Deb Kruk sharing her and her son Brian's story with vascular Ehlers-Danlos syndrome, or VEDS. If you're ready to meet others, get involved, or need support, there are links for you in the episode show notes, and there are always events going on in different areas around the country. I know quite a few people are heading to Portland, Oregon for the symposium on May 11th, and of course Reds for VEDS Day is right around the corner in May as well. There's also a link in the episode show notes for the VEDS Collaborative Natural History Study, a research study led by Dr. Shireen Shalhoub, open to people with VEDS, Marfan, Loeys-Dietz, and similar connective tissue conditions. If you like this show, be sure to share it on social media or give it a rating or a review. You can also support the production of this podcast by joining my Patreon. As always, my top-tier patrons are listed in the episode show notes. Next week, we'll talk to Sheila Felsky, sharing her story with VEDS. See you soon.